Free paper 9. The speaker is Ananya. Present? Dr. Ananya? Dr. Shivani Sharma? Please start.
Good morning, everyone. Good morning, sir. Good morning, ma'am. Myself, Dr. Shivani Sharma, working as senior resident in department in GMC Kathua. So the topic for my paper is role of subconjunctival bevacizumab injection in management of pterygium. Pterygium, a degenerative condition of subconjunctival tissue, presents as a triangular flap, most commonly seen in the interpalpebral region, predominantly seen nasally and often bilateral. The pathogenesis of pterygium is very complex, involving multiple factors such as environmental factors and chronic inflammation have been postulated. Various associated studies have demonstrated that along with degeneration and inflammation, angiogenesis is also seen. The development of pterygium is dependent on a changed angiogenic stimulator to inhibitor ratio. Jin and colleagues demonstrated that there is drastically lower levels of pigment epithelium-derived factor, angiogenic inhibitor, and increased VEGF levels. Bevacizumab, a humanized monoclonal antibody which acts on all types of VEGF, it binds to soluble VEGF and inhibits the binding of VEGF molecule to the receptors on the surface of the endothelial cells. So this may potentially suppress the neovascularization and prevent or retard the progression of pterygium. So this study aims to evaluate the role of subconjunctival bevacizumab in the management of pterygium. This study comprised of 18 patients with primary pterygium, all above the age of 18 years. All gave their written consent for participation. Exclusion criteria included pregnant and lactating females, history of any ocular trauma and infection, contraindication for bevacizumab, inability to follow up. Demographic information and symptoms were noted. Complete surgical, medical, and ocular history was noted. Thorough ocular examination, including visual acuity, tonometry, and slit lamp examination was done. The grading of pterygium using TAN and co-worker classification was done. The grading grade 1, which is atropic, grade 2 intermediate, and grade 3 fleshy, which is basically dependent on the episcleral vessels present under the pterygium. So length and width of pterygium was noted by slit lamp examination before the administration of subconjunctival bevacizumab. Photographs were taken before the procedure. 0.2 cc of bevacizumab was loaded in 1 ml tuberculin syringe with a 30 gauge needle. Topical anesthesia proparacaine was instilled before the procedure. The patients were followed up on day 1, 1 week, and 1 month post the procedure. These are the pictures. On the right side, these are before the procedure, and the left side is after the procedure. Next picture, same right side before the procedure and left side after the procedure. These are the correlation graphs which are basically taken on the day 1 and the day 7. And the coefficient which is coming out, that is below 1, showing no significant relation between them, no strong association. This is a graph which is present on the on the day 1 and on the month 1, that is after 4 weeks. And the lower graph is basically between the size and the width of the pterygium. All these graphs, they are not showing any positive or very strong correlation because coefficient is almost below the 1. So the mean age was seen to be 34.94 years, plus minus 10.55 standard deviation. Number of persons present according to the gender is taken in the graph. Maximum with the females, number of females with the right eye, that is 6 number of females. The p-value on the day 1 versus day 7.
Kindly summarize, time is up.
Okay. This study, there was no significant difference was seen in change in size of pterygium after 1 week, the p-value being 0.8. No difference was observed after 1 month as well, p-value being 0.74. In my study, no significant reduction in color intensity was noted, p-value being 0.2. So various studies have been done on the use of bevacizumab in treatment of recurrent pterygium, but in my study, I did not find any reduction in the size, width, or in the color reduction or the vascularity of the pterygium. So, but there were no significant ocular and systemic side effects also after the use of the bevacizumab. Thank you.
Thank you, Dr. Swan. Any question? Next by Dr. Jitendra Kumar. Dr. Jitendra present? No. Next is Dr. Pranathi. Dr. Ria. Everyone kindly stick to the time.
A very good morning, respected judges and each one of you present here. Myself, Dr. Ria Srivastav, a ratified AIOS member. So today, I'll be talking on pityriasis palpebrarum, seen as rare presentation with squamous blepharoconjunctivitis. I have no financial disclosure. So pityriasis palpebrarum is a rare dermoocular inflammatory manifestation which is caused by Pityris pubis, and it is seen at the base of the eyelash follicles. It can present from itching, which is the most common symptom seen, to squamous blepharoconjunctivitis in severe cases. In most of the cases, it is observed that the ocular infestation occurs after pubis infestation, and this transmission usually occurs by hands. So it is commonly seen in people with poor hygiene or sexually transmitted diseases. Coming to epidemiology, the worldwide prevalence is about 1 to 2%. However, in countries with higher sexually active adults, it can range from 2 to 10%. So the aim of this study is to report a case of a 70-year-old male presenting with squamous blepharoconjunctivitis caused by Pityris pubis infestation without involving any other body parts. So it is a case report seen at Regional Institute of Ophthalmology, and consent of the patient was taken. So a 70-year-old Indian male presented to us with chief complaints of diminution of vision, eyelid itching, and crawling sensation with 6 months history. On slit lamp examination, blepharitis with crust was seen all over the eyelids. On removing the crust, bleeding surface was revealed. There was also marginal conjunctivitis and senile cataract. On further subjecting to higher magnification, characteristic louse and nits were seen anchored to the eyelashes. And as we can see here, the flat and transparent body of the adult lice is seen with freshly sucked blood meal. So for diagnosis, a good clinical examination becomes very important. And for confirmation, wet mount microscopy was performed, and the peculiar features of the crab louse were identified, pointing towards pityriasis palpebrarum. So now how to manage the patient? Firstly, mechanical removal of lice and nits was done after applying lignocaine and petroleum jelly. He was also started on oral ivermectin 200 microgram per kg and a repeat dose after 10 days. He was advised on Vaseline ointment massage twice daily with improvement of personal hygiene. Patient came to us after 1 month for follow-up. There was marked improvement in his symptoms, and on slit lamp examination, no new louse or nits were visible. So coming to discussion, Van der Weg et al. Also found that ocular infestation by Pityris pubis can mimic conjunctivitis, and we need to perform careful slit lamp examination. Rajan et al. Also stated that rare presentation required attention to hygiene and exclusion of systemic associations. Coming to our study, we also found that pityriasis palpebrum is a rare cause of blepharoconjunctivitis requiring timely diagnosis, and our study also stands unique in terms of being a primary ocular Pityris pubis case. These are few differential diagnoses. So to conclude, a high index of suspicion is a key, and it requires proper clinical and microscopic examination. We also need to identify any predisposing factors and educate the patient on hygiene. So the take-home message is that we have to always consider pityriasis palpebrarum in patients of chronic blepharoconjunctivitis who are otherwise not responding to conventional therapy. And as seen here, it can present as isolated ocular disease in elderly patients. So we have to examine the lashes very cautiously. So for successful outcome, a high clinical suspicion and holistic management is a must. These are my few references. Thank you.
Any question? What is new in your case?
So, as I already told that the pityriasis palpebrum mostly affect, ocular infestation occurs secondarily after pubic involvement. But in my case, it was a primary case of ocular infestation and there was no involvement of the pubic area.
Thank you.
Next presenter, Dr. Sindhu Kumari. Please come.
Dr. Usha Bharti present. Usha Bharti. Dr. Rajeshwari. No. Dr. Visu Garg.
Dr. Sindhu, please switch
Yeah,
to
please
this stance.
be ready on this podium. Meanwhile, Dr. Sindhu will present. Not working, Dr. Sindhu. Kindly press. Mic is not working. Press it. It's on. Kar.
Good morning, everyone. My study is prevalence of chronic allergic conjunctivitis in pterygium cases. Pterygium is a benign fibrovascular growth of conjunctival tissue extending onto the cornea, often associated with UV exposure, dust, and inflammation. Chronic allergic conjunctivitis is long-term inflammation of conjunctiva due to allergen causing itching, redness, tearing, and papillary reaction. Rationally is chronic allergic conjunctivitis may promote pterygium via fibrovascular changes. Aim of this study is to evaluate the association between pre-existing chronic allergic conjunctivitis and pathogenesis of pterygium. This is a retrospective study, duration 1 year, done at Regional Institute of Ophthalmology. Sample size is 76. More than 18 years of the patient and patient presenting with pterygium willing to participate were included in the study. Ocular surgery, trauma, other ocular pathology, unreliable history excluded from the study. Patients were surveyed via a structured questionnaire to assess history of chronic allergic conjunctivitis, including symptom, duration, and specific trigger. SPSS software version 22 was used for the data analysis. 40 patients were male and 36 female. Mean age of the presentation was 42.2 plus minus 13.8 years. 65% patients were from the rural population and 35% patients were from the urban population. Out of 76 patients, 23 patients gave the history of chronic allergic conjunctivitis. Prevalence of chronic allergic conjunctivitis in pterygium is 30.26% in this study. Type of allergen specified by the patient was 55% patient, 53% patient did not give any particular allergen history. 30% patients were having dust allergy, 9% VKC, and 9% photoallergy. And this is the chart shows outdoor exposure analysis. 68% patients were having no outdoor exposure in patients of chronic allergic conjunctivitis with pterygium. Patient with chronic allergic conjunctivitis presented 100% patient of chronic allergic conjunctivitis presented bilateral pterygium. Various previous study has found that the risk factor fall in 3 categories: demography, lifestyle, and environmental factor. Most common is sunlight exposure. Similar to previous studies, rural population and outdoor exposure occupation shows a higher risk for pterygium. But a significant 68% patient with pterygium and chronic allergic conjunctivitis reported no outdoor exposure. Challenges typical UV exposure risk, suggest indoor allergen or other factor at play. In current study, 30.26% prevalence of chronic allergic conjunctivitis support a link between chronic allergic conjunctivitis and pterygium. Study by Aini et al. In 2025 and 23, they have concluded in their study that ocular and systemic allergy increases pterygium risk, and chronic allergic conjunctivitis is an independent risk factor for the development of pterygium. This is the illustration of immune pathway from chronic allergic conjunctivitis to pterygium after allergen exposure. Activation of eosinophil and mast cell causes chronic ocular surface damage, which causes matrix remodeling and angiogenesis, which can develop pterygium. Retrospective design, small sample size, and potential recall bias is the limitation of this study. Conclusion of this study is pre-existing chronic allergic conjunctivitis prevalence in pterygium is notable, warranting further investigation into allergic conjunctivitis as a risk factor for pterygium. These are the references. Thank you.
Thank you. Next is Dr. Vasu Garg. Priyanshi Jain present. Dr. Priyanshi Jain. Dr. Deepti Yadav. Dr. Hari Kumar. Dr. Manisha Gupta. Dr. Sahil Jain. Sahil Jain is present. And Dr. Mahima. Hello. Dr. Vasu, please.
Good morning, everyone. I'm going to present my topic, which is etiology and epidemiology of infective corneal ulcers in Delhi NCR region. So coming to the ulcers, we know that cornea is responsible for 75% of eye's dioptric power, and it's highly susceptible to microbial keratitis. A study in South India reported the incidence of ulcers to be suggestive that 8,40,000 new cases are seen annually. And effective management is hampered because of poor health, lack of education, misuse and over-the-counter drugs. And we did a study in Santosh Hospital, Ghaziabad, aimed to explore the etiology and epidemiology of infective keratitis in the region. So we wanted to see what are the common causes, what are the characteristics of infective keratitis, what are the organisms which are causing various types of ulcers, and to see the morphological features and to correlate the findings with the causative organisms. So this was a hospital-based cross-sectional study, and patients of infective corneal ulcers attending the cornea clinic were taken. A complete history followed by slit lamp examination of the conjunctiva, tear film, anterior chamber, everything was done, and fluorescein staining was performed to provide additional information like dendrites and pseudodendrites. And in lab workup, except for viral cases, we anesthetized and exudates were removed. The samples were taken from the ulcers border, and gram staining and Giemsa staining were performed. So cultures, we inoculated them into various different mediums like blood agar, chocolate agar, and we saw what kind of organisms we are having in our study. So in our study, we found that most of the cases of the corneal ulcers belonged in the middle age group region from 21 to 40 years of age, and also a few cases more than 60 years of age group. We saw 80% of the patients were males, so because they are more involved in outdoor activities. Most of the patients, 60% belong to the lower socioeconomic status, and 50% of the patients were laborers, 20% were working in the agriculture industry. 50% patients had a predisposing history of ocular trauma, and a few had a history of chronic dacrocystitis. Then we saw that trauma was a predisposing factor in a lot of patients, where 18% patients had a history of trauma with vegetative matter, 30% had a trauma with objects like stone, dust, metals, and various different chemicals. Based on clinical diagnosis, after doing cultures, we found that we had 50% of the cases were viral, then 25% were fungal, and then bacterial cases were there. And in terms of viral, we saw that 50% of the viral cases were adenovirus based, then 30% of herpes simplex and 20% of herpes zoster cases were seen. We saw in bacterial cases, in 14 bacterial cases, that Staph aureus and Streptococcus pneumoniae were the most common organisms. And in fungus, we saw that Aspergillus and Fusarium were the most common causes isolated in our study. So we found in our study, we wanted to just see the risk factors and pathogens that were responsible for the different corneal ulcers. We saw that more common it was in males, and between 30 to 40 years of age group and over 60 years of age group was the most common age group. And 60% of the patients belonged to lower socioeconomic backgrounds. They were mostly laborers, and trauma was a risk factor in 50% of the patients, followed by steroid use and chronic dacrocystitis. Main causes of trauma were stones and metal objects, and pathogens were mostly, which were identified, were viral, followed by 23% bacterial and fungal, with strep pneumonia and Staph aureus as the main bacterial culprits. Aspergillus and Fusarium were our most common fungal pathogens isolated in our study. Thank you so much.
Okay. Thank you. Next is Dr. Sahil Jain. It's non-competitive. Sir.
A very good morning, everyone.
What we can do is
A very good morning, everyone. My topic is on the preoperative versus the intraoperative subconjunctival C role in preventing the pterygium recurrence. First of all, moving towards the introduction, pterygium is a wing-shaped fibrovascular conjunctival growth associated with the UV exposure, dust, wind, and dry climate. Recurrence after the surgery remains the major challenge, where we can use various interventions such as the conjunctival autograft and the mitomycin C, which used to reduce the recurrence. Aims and objective to compare the role of the preoperative versus the intraoperative subpterygial mitomycin C injection in prevention of its recurrence, where the primary objective is to evaluate the efficacy of the mitomycin C, and the secondary objective is to study the demographics. The hypothesis, where the null hypothesis says that efficacy of the preoperative mitomycin C subpterygial injection 1 month prior to the surgery in preventing the recurrence is same as when compared to the intraop, whereas the alternative hypothesis says that it is more or less there is a difference between the two. The inclusion criteria includes that age more than 18 years, all the patients with a primary pterygium who have given the written consent, and the exclusion criteria includes any pre-existing scleral disease, any patient with the anterior uveitis, anterior or posterior cephaloma, any intraocular surgery within recent 1 month. Methodology is that my study is about the prospective randomized control trial, where we have taken the 78 patients and divided them into the two groups. Group 1 is with the intra-op MMC injection 0.15 mg per ml for 2 minutes plus bare sclera excision, where the group 2 is the preoperative MMC injection 1 month prior to the surgery, and then we did a bare sclera excision, and the follow-up was done on the post-op day 1, week 1, and first and second and third month. The same as we have seen the flowchart, that the complete ophthalmological record has been recorded on the very first visit. After the informed consent is taken and the patient is divided randomly divided into group 1 and 2, and the post-operative follow-up day 1, 7, and month 1, 2, and 3, we do a comprehensive ophthalmological examination again, and we analyze the data. Results, the recurrence rate at the 3 month in the intraoperative MMC, it was 7.7%, while in the preoperative, it was 10%. So there is no statistical difference between the two. The age distribution is very comparable, and the post-operative complication, as we can see that in the intraoperative group, it is in the 20 patients out of the 80 patients, and in the preoperative group, it is only into the 10 patients. Frequency of the complications, we see that there is redness almost among the 10 patients, and scleritis among the 3 patients, and limbal stem cell deficiency among 2 patients, 1 patient with the dry eye, 1 with the granuloma, and 1 with the Dellen. All the complications were seen in the group 1, where we have given in the intraop MMC and bare sclera, while in the group 2, few only dry eye, only redness and scleritis has been seen. As discussion part, we see that both the preoperative and intraoperative MMC reduce the recurrence efficiently. Preoperative groups show fewer complications, while the findings were consistent with the published literature. My limitation is that it is a short 3-month follow-up with a single center and small sample size. In the conclusion, both the MMC approach are safe and effective in prevention of the recurrence. Preoperative injection may offer a slight advantage, and in the future, long-term multi-center study is recommended and can be used as an adjunct treatment to this. Thank you.
thank you. Dr. Sahil, next is Dr. Mahima. Dr. Vansika.
डॉक्टर उषा का भी बोल देना नाम इनका वो आ गए अभी
आगे तो लास्ट में करेंगे बेटा, सीक्वेंस बीच में
जी
नहीं.
लास्ट में बोल देना
डॉक्टर वंशिका, तुम तो डॉक्टर पूनम यादव. या स्टार्ट.
Good afternoon, everyone. I will be presenting my research on clinical and microbiological profile of microbial keratitis and its antibiotic sensitivity. Infectious keratitis is characterized by corneal epithelial disruption and inflammation resulting from bacteria, fungi, viruses, and parasites. It is also termed as a silent epidemic in resource-limited conditions. Risk factors include injury to corneal surface, prolonged application of topical steroids, conditions causing dry eye, incorrect use of contact lenses, inadequate eye hygiene, and underlying systemic diseases like diabetes mellitus hinders its healing. This study aimed to assess the incidence, associated risk factors, microbiological characteristics, and antibiotic susceptibility profile. This was a one-year prospective longitudinal study conducted at Department of Ophthalmology and Microbiology at GMC Amritsar. Included patients aged 25 to 75 years with signs and symptoms suggestive of corneal ulcer, patients with cognitive impairment, refusing informed consent, unwilling or unable to receive treatment, and previously treated corneal ulcers or any other anterior segment pathologies were excluded. A thorough history was documented for each patient, covering the onset and duration of visual symptoms, any history of trauma or precipitating factors, previous occurrences, systemic conditions, and prior antibiotic or steroid use, and any relevant allergic history was recorded. Every patient underwent a comprehensive ophthalmic assessment which included best corrected visual acuity, slit lamp biomicroscopy to evaluate the size, depth, margin, associated features such as hypopyon and stromal infiltration, examination of the posterior segment if possible, and B-scan ultrasonography. Corneal scrapings were obtained under topical anesthesia using 0.5% proparacaine, and scrapings were collected under slit lamp magnification from edge and base of ulcer using sterile number 15 surgical blade. Samples were immediately transported to the Department of Microbiology. Then the data was collected during the study were compiled and analyzed to evaluate the incidence risk factors, microbiological pattern, and antibiotic sensitivity profile. These are the few pictures on day of presentation. 118 patients were included in our study, with mostly patients belong to 45 to 64 age group. Approximately 50% belong to this age group. Majority of cases occurred in male, with a male to female ratio of 2.5:1, and rural population exhibited a higher prevalence of 75% as compared to urban residents. Farmers were mostly affected, 49%, with field workers making up to 19% and carpenters 5%. Housewives and other occupations constituted 26% of the age. Injury with vegetative matter was the most frequently observed risk factor in our study, with a percentage of 55%. Foreign body included 14%, and any other unknown cause included 29%. When noted while clinical presentation was with epithelial defect of less than 3 mm was noted in 31%, 3 to 6 mm in 61%, and more than 6 mm in 7% of the participants. Hypopyon was observed in 27% of participants. On microbiological analysis, 66 cases were positive on microscopic examination of corneal scrapings. 40 cases showed no detectable organisms. Fungal hyphae was observed in 59% of cases, gram-positive bacteria in 16%, and gram-negative bacteria in 9% of the cases. Mixed result was found in 15% of the corneal scrapings. Culture result was positive in 24 cases, with fungal growth observed in 13, while bacterial in 11 cases. Among fungal isolates, Fusarium constituted 69% and Aspergillus 23%. Among bacterial isolates, Staph aureus 45% was noted in 5 culture plates, and Pseudomonas, Staphylococcus epidermidis, and Streptococcus was noted in 18%. These are few bacterial concerns. On basis of microbiological and clinical characteristics, final diagnosis was made. Fungal ulcer was identified in 45%, bacterial in 18%, and viral in 10% of the cases. Among 11 positive bacterial cultures, half of the samples were sensitive to cephalosporin, fluoroquinolones, beta-lactams, tobramycin, and erythromycin. Sensitivity to amikacin and linezolid was noted in 70 to 75% of cases, while 60% responded to tetracycline and vancomycin and imipenem or meropenem. aztreonam, ampicillin, gentamicin showed sensitivity in only 25 to 37% of the samples. An increasing resistance trend was observed for ampicillin, gentamicin, tobramycin, and aztreonam. No resistance was identified for colistin and clindamycin. A discussion. Most affected age group was 45 to 64 years. Average age group constituted 51 plus minus 12.48 years. Male to female ratio was observed to be 2.5:1, and predominance of middle-aged rural males was
Kindly
noted.
summarize. Kindly summarize it.
So among fungal cases, Fusarium and Aspergillus was the most common fungi, and the bacteria Staph aureus was the main causative factors, and emerging resistance to aminoglycoside and beta-lactams was noted.
So any difference means you have done your antibiotic sensitivity in your region, most likely in Punjab. So have you compared that what is the antibiotic sensitivity done in the previous literature at other part of the India?
Sir, other parts also same resistance was also noted in some other studies also. So reference was taken.
Okay, thank you. Dr. Vansika is not in the study. You may continue.
Good afternoon, everyone. I'll be presenting the demographic profile and clinical outcomes of herpes simplex keratitis patients in central India. As we know, herpes simplex viral keratitis is a leading cause of corneal blindness in the world. Globally, it is estimated that over 1.8 million people are affected by it each year. It has a tendency to remain latent in the trigeminal nerve ganglion and reactivates under host stress and environmental factors. The clinical spectrum of HSK is broad and includes epithelial, stromal, and endothelial forms. The epithelial form is observed during active viral replication. Stromal keratitis is largely immune mediated. Endothelial keratitis involves inflammation of the corneal endothelium and decimates membrane with or without involvement of trabecular meshwork. Diagnosis is often clinical due to limited molecular testing. As HSK has variable clinical presentations, treatment protocols have to be customized as per the type and severity of the presentation. Our objectives were to evaluate the demographic and clinical characteristics of HSK patients and to analyze their clinical treatment outcomes, duration, complications, and recurrences. Ours was a prospective study done for the duration of an year at a tertiary care center. Best corrected visual acuity and intraocular pressure were recorded. Clinical diagnosis was based on history, slit lamp evaluation, and fluorescein staining. The clinical findings were documented, and based on that, HSK was classified as follows, and treatment was given as per the type of HSK. Our results showed that out of the total 32 patients, there was a male predominance. Most of the patients were in the age group of less than 30 years or more than 60 years. The most frequent clinical subtype of HSK seen in our study was stromal keratitis, followed closely by the combined type of presentation as shown in this graph. At presentation, BCVA in most patients ranged from +4 to +1 on logMAR chart, which improved after treatment, and most patients had BCVA in the range of +1 to +0.5 as shown in this chart. This table shows the mean BCVA before and after treatment along with treatment duration for each subtype. Endothelial keratitis, stromal keratitis, and combined presentations had a longer duration of treatment as compared to the other subtypes. Complications most commonly seen were corneal scarring accompanied by vascularization. 3 cases underwent penetrating keratoplasty for corneal scarring, and 3 cases underwent combined keratoplasty with cataract extraction for complicated cataract and leucoma adherens. Tablet acyclovir 400 mg BD was continued for 2 years in cases undergoing keratoplasty. Our cohort showed a bimodal peak with similar number of patients in the age group of less than 30 years and more than 60 years. This was in contrast to Western study where older adults, mostly over 60 years of age, were involved. Younger age group predominance was seen in a Southeast Asian and a Middle Eastern study. Stromal keratitis was the most frequent subtype in our study, and combined presentations were the second most frequent. Our results corroborated with another Indian study in terms of stromal type being the most frequent subtype. However, a Japanese and French study showed epithelial keratitis followed by stromal most common. The visual outcomes in study, post-treatment and average treatment duration in our study aligned with the literature. Stromal keratitis with and without epithelial ulceration were the immune-mediated sequelae of viral antigen reactivation in the cornea, contributing to the higher complication rates and recurrences seen in these subgroups. The recurrence and complication rate in our study was lower as compared to the literature. Our study showed both similarities and deviations from the global data. It defines the demographic features and clinical outcomes of HSK patients in our region. Therefore, regional studies help in overcoming the data lacunae in that area and in turn lead to guideline establishment for treating HSK, especially where diagnostic modalities are not available and affordable. These are my references. Thank you.
Thank you. Dr. Poonam, please. Anyone left? After her, you can present.
Good afternoon, everyone. Myself, Dr. Poonam Yadav. Today's my presentation aim is to discuss a case of keratoconus. Patient came with chief complaints. A 29-year-old male presented in OPD on 6/10/2024 with both eye diminution of vision from 2 years. The diminution of vision was gradual, progressive, and painless. There was history of mild itching and redness on and off in both eyes. No history of wearing specs in past. Past history. No history of hypertension, diabetes, or any other systemic illness. No history of ocular surgery, ocular trauma, or no history of decrease in vision in family. On ocular examination, uncorrected visual acuity, right eye 6/12, left eye 6/24, best corrected visual acuity 6/9, left 6/24, IOP was 12 and 10, extraocular movements full and free in both right and left eye, pupils are normal in size and reactive to light, eyelid and adnexa normal, conjunctiva there was mild congestion both eyes, cornea clear right eye, left eye prominent corneal nerves and flesh ring seen, anterior chamber iris was normal both eyes, lens was clear in both eyes. Posterior segment examination, media normal, disc shape round, disc color pink, disc margin clear and well defined both eyes, cup disc ratio 0.4:1 both eyes, and neuroretinal rim was healthy both eyes. Anterior segment photo, right eye, there was mild conical protrusion in right eye and there was conjunctival congestion and papillae seen. Left eye anterior segment, there was inferior steepening and conical protrusion, vertical Vogt seen. Here. These are prominent corneal nerves. Under cobalt blue filter, these are there was Fleischer's ring. The case summary was 29-year-old male presented with chief complaints of diminution of vision both eyes associated with itching on and off, aided visual acuity of 6/9 with minus 1.25 dioptric cylinder at the axis of 25° in right eye and 6/24 with two dioptric sphere and minus 5.50 dioptric cylinder at 155° in left eye. On examination, right eye appeared to be within normal limit. Left eye showed presence of prominent corneal nerves along with the brown colored incomplete pigmented line inferiorly suggestive of Fleischer's ring along with deep vertical stromal folds which disappeared on pressing the cornea, suggestive of Vogt stare. Posterior segment examination is within normal limit in both eyes. Clinical diagnosis was left eye keratoconus. For diagnosis, pentacam was done. Right eye keratometry values were K1 flat meridian was 43.5 diopter, K2 was 45.8 diopter, and astigmatism was 2.3. And left eye, there is much difference between K1 and K2, 46.5 diopter and 53.5 diopter. And there was thinning of cornea with pachymetric thickness 414 micrometer. Berlin Ambrosia Enhanced Ectasia Map is used for diagnosis of keratoconus. Amsler's chromic classification, stage 1 eccentric steepening, myopia and astigmatism less than 5 diopter, mean central K reading, keratometric reading less than 48 diopter. Stage 2 myopia and astigmatism 5 to 8 diopter, mean central K reading less than 53 diopter, absence of scarring, minimal corneal thickness for more than 400 micrometer. Right eye was under stage 1 and left eye under stage 2. Indices for progression. Criteria for keratoconus progression based on international guidelines such as the Global Census on Keratoconus and Ectatic Disease 2015 and Corneal Cross-Linking Trial Standard. Progression is defined as documented change in at least two or three of the following parameters. First is keratometry changes. Increase in steep keratometry, Kmax more than or equal to 1 diopter. Increase in mean keratometry, Kmean more than or equal to 0.75 to 1 diopter. Refractive changes. Increase in manifest cylinder, astigmatism more than or equal to 1 diopter. Increase in manifest spherical.
Kindly summarize, Dr. Poonam.
Okay, sir. Sir, we will go for investigations.
Yes.
Then treatment, sir, for congestion of the olopatidine, and then sir CMC contact lens, and then if required follow-up is C3R.
Good. So, have you done your treatment or you are planning to do it?
Sir, planning for treatment.
Okay. Thank you.
Thank you.
Next. Doctor. Every people kindly help. Audio visual. Yes.
Good afternoon to everyone. Myself Usha. I am here presenting a paper on morphometry of the corneal endothelium in industrial brass workers compared to normal population attending IOPD in tertiary care center in Saurashtra region. So the corneal endothelium is a single non-degenerating cell layer that plays a vital role maintaining the corneal clarity and visual acuity. Occupational exposures such as infrared, ultraviolet radiation, metal fumes and the particle matter are major risk factors for endothelial cell loss. So the industrial brass workers are particularly vulnerable due to the continuous exposure to the high temperature furnaces and hazardous substances. Early detection of corneal endothelial changes using specular microscopy is crucial for prevention, timely intervention and the protection of vision. So my aim and the objective for these studies are to evaluate the corneal endothelium damage in industrial brass workers and to assess endothelial cell density morphology using specular microscopy to suggest the preventive measures for protecting corneal health in brass workers. So it is a comparatively cross-sectional study done in ophthalmology OPD at Tertiary Center in Jamnagar, Gujarat. So the study duration was for 12 months. The study population is divided into two groups. Group 1 is a brass industrial workers, mainly male workers to have an occupational bias. And second is a non-industrial normal population who is not exposed to any high temperature occupation. So sample size is total 120 divided equally in both the groups. So the inclusion criteria I already told, male patients more than 18 years. Exclusion criteria for the patients who having other ocular eye diseases like glaucoma, which are mainly affecting the corneal endothelium, uveitis, retinal diseases, diabetes, hypertensive retinopathy, etc. Pre-operative assessment, we have detailed examination of visual acuity, anterior segment, and have done the topcon specular microscopy. Then I have done this specular microscopy by using a topcon 1SP, which was available in our institute. So the results were, in the age it wasn't significant, but by comparing the ECD, that is endothelial cell density, the coefficient of variance, hexagonality, compared to both the groups, that is the brass workers and the normal population, the brass workers, they have decreased endothelial cell density compared to the normal population, which is statistically significant, and they had increased coefficient of variations and decreased hexagonality compared to the normal population. So this is the age-wise distribution divided into 5 years gap, 30, 30, 39, 40. All the groups same showed that there is a decrease in endothelial corneal density and increased coefficient of variation and decreased hexagonality. And age-wise comparison also showed the statistical significance, which p-value was less than 0.001%. This is the correlation showing the same, that it has an negative correlation with the exposure, that is same decrease in both, but showing a positive correlation with the central corneal thickness, that it has increased compared to the normal population. My discussion is this study demonstrated significantly reduced endothelial cell density, lower hexagonality, and includes pleomorphism and polymorphism in brass workers compared to the controls. These findings highlight the advanced impact of chronic occasional exposure to UV and infrared radiation on corneal endothelial health of brass workers who are constantly exposed to the thermal radiations. So the conclusion is corneal endothelial damage is significantly higher in brass workers, and severity correlates with the duration of exposure. So we need to take screening measures like periodic ophthalmic examination for brass workers, specular microscopy to detection of endothelial changes, regular monitoring of visual acuity and corneal thickness, health surveillance recorders. So we can give them protective equipment to protect them from the UV and the infrared exposure, like face shields or welding helmets, or have a proper ventilation and exhaust system. So we also have the limitation to study that this is a single center cross-sectional study with a limited sample size. So we need longitudinal studies with larger cohorts are required to confirm the causal relations and evaluate the preventive strategies. These are references. Thank you.
Thank you. Anyone from this podium theater, cornea and external disease left for presentation? So almost we finished the session. Thank you everyone for the presentation. Those who are presenters can join us for the group picture. Everyone in the hall join for a group photography. Thank you.